first sort of 5 years of my life, it wasn't a great experience. I found that doctors never really seemed to care about what I cared about. They had their diagnostic plans, they had their research, and they just kind of followed the path, like a one-size-fits-all. They said, you know, you have muscular dystrophy, this is your life. This is the treatment, this is what you're going to do. And so by about 5-6 years old, my parents and I were a little frustrated with how sort of the system was operating, very frustrated with the drive. It was a very long way away from our home in Port Elgin. And it was in sort of dialogue with some friends that we had started to hear things about London, and that London, specifically LHSC, might actually be a better fit for me. So when I was about 6 years old, we made the transition and we moved all of my everything basically to London, so that I have a one-stop shop for doctors, surgeons, physical therapists, occupational therapy. We would do it all here. And we were really, really encouraged by the change in culture here, that we found that pretty much right off the bat, some of the first questions that we were being asked were, what were our objectives? What were our goals? What did we see for the future for Jeff? And how could that team support that? Which was very different than what we'd experienced previously. And it fundamentally changed the ways that we not just looked at me and not just the way that we looked at my impairment, but the ways in which we would then start strategizing my movement forward. My parents were tremendous, fierce, strong, effective advocates for me, but they also knew that they couldn't do that forever. And if I was going to be okay, if I was going to survive, I would need to start to develop those skills at a really young age. So my parents started sort of teaching me. They brought me, they involved me in a lot of the advocacy fights that were happening as I was moving through elementary school, into high school, moving into university, into my field of research now, disability studies at King's, that I then actually was given the opportunity to get involved with patient advocacy at the hospital through LHSC, to start to give that patient voice, to show that healthcare actually works better when we work together. As somebody who has yelled into the abyss several times in my life, that you bring up a really important problem and nothing ever happens about it, that could be extremely frustrating. That hasn't been my experience with LHSC, that as soon as I identify something, the gears start to turn and things start to move. And yes, change can be slow at times, but at least there's a real awareness and acceptance that we need to move forward on some of these things. Being able to say and reflect and look back at the experience that young children who are growing up with physical disabilities, as they enter into the hospital system, to know that their experience in childhood is not going to be like mine, that the picture that is painted for the children, for the parents, is one of opportunity, and not simply one of a hard plan based on diagnosis. To me, that's emancipatory. And to me, that's going to paint a better future for people with disabilities, not just here in London, but in all of Southwestern Ontario. And to be able to say that you were a part of that, to be able to say that you were a part of making lives better for people that come after you, I think is actually very unique. It's a unique opportunity, and it's something that I think our patient advisors can be extremely proud of, because they are integral in making LHSC better. And I would encourage everyone in this community that if you have a problem with the way healthcare runs in this community, if you have a problem with the way that medicine and medical care is delivered, get involved, because you actually can be a critical piece in making it better, in resolving some of those problems. But it means you gotta get involved. And as I said, healthcare is not just about doctors versus patients, it's about collaboration. And to do that collaboration, we need you to be involved too.